member for Courtenay-Comox.
Honourable Speaker, we are debating the limited use of involuntary treatment to keep our most vulnerable youth and adults who are at risk of harm to themselves or others safe at modernized, compassionate facilities with 24/7 psychiatric and medical supports. It's important to acknowledge the complexities of having a loved one who has serious destructive behaviors, whether self-inflicted or lashing out, whether seated in mental health or substance use or both. It is devastating. There can come a time when it feels like the only solution is an involuntary admission to a facility to keep them or others safe. If only it could be that simple. Unfortunately, the specter of involuntary care increases stigma and can work against the goal of compassionate care and safety of the person and others. On the Foundry website is the story of Ashley, whose mental health spiraled down dangerously. This young person says she hid that she was hearing voices for 2 years because she was fearful that she would be, quote, locked up in a padded room for the rest of my life, unquote. Ashley would have benefited from an early intervention before her mental health broke down significantly. Taking away someone's freedoms is a big deal. And then there are the folks with substance use disorders, whose destructive behaviors you just want to stop, especially when it leads to psychosis. If only you could separate them from the drugs that are destroying their lives. Unfortunately, the evidence is in that there is a heightened risk of death after compulsory treatment. These are just two of the unintended adverse outcomes. Taking away someone's freedoms is a big deal. We all benefit from the Canadian Charter of Rights and Freedoms, and that includes people who are subject to involuntary admission under the Mental Health Act. In the one-year span of 2021 to 22, there were approaching 29,000 involuntary hospitalizations, including repeat patients. In January 2021, the representative for Children and Youth released her report, Detained: Rights of Children and Youth under the Mental Health Act, revealing the number of involuntary admissions of adults increased by 57%, but for children and youth, the increase was 167%. It's important to note that those figures covered a 9-year period from 2008 to early 2018, primarily when the opposition was in government. It begs the question of what is limited use of involuntary treatment. To protect the charter rights of those tens of thousands of British Columbians, last year our government passed amendments to the Mental Health Act, which led to this year's selection of the Canadian Mental Health Association to develop and deliver, in partnership with the Health Justice, the Community Legal Assistance Society, and Métis Nation of BC, the independent rights advice service recommended by BC's Ombudsperson in 2019. Providing information about their rights and options will be a phone call away. This help is independent of the health professionals who are making the decisions about their care. The representative for Children and Youth raised the question of balance. If so many resources are dedicated to involuntary care, what's left for voluntary care? Since taking office, our government has been building a seamless system of care with a particular focus on youth and marginalized Indigenous people. Involuntary admissions, yes, but with voluntary programs at the forefront, simply because early intervention and willing participation is the recipe for success. I mentioned Foundry earlier. In speaking to Angie Prescott at our Comox Valley's award-winning Centre for Youth, I heard that the options for children and youth aged 12 to 24 on Vancouver Island are robust. The new Redfish Healing Centre in Coquitlam provides a welcoming space with 105 beds, 15 of which are an enhanced care unit, designed for people who need help managing aggression or behavior issues in addition to treatment for their mental illness and substance use challenges. It's been quoted as saying, as this care model is a catalyst for change, and our government is rolling out this model to regions across BC. It's only one of many additions with the more than $1 billion dedicated in the 2023 budget. In the face of the complexities of providing safe and compassionate care, our government is committed to continue assessing all the facets of our mental health and substance use services, including the use of involuntary admissions for care, in order to keep people and communities safe.
Thank you, Member.
Madam Speaker.
Thank